David, thank you very much for being with us in Exo Leaders. Exo Leaders was created by AIM Group. AIM Group is a consulting firm. We do organizational transformation. David, I want to welcome you to the Exo Leaders podcast. You're the CEO of BioscienceLA.
Thanks for having me, first of all. Just thrilled to be here. I'll try to give the abridged version. I've been living in Los Angeles for almost 25 years now, but was in the Bay Area before that. Grew up in Pennsylvania, and I have moved to California to go to Stanford for undergrad and lived in the Bay Area building technology companies as a part of a little venture capital firm, as part of an executive recruiting firm. So very embedded in the tech world in the Bay Area. And then I came to Los Angeles back in 2000 to get my MBA from UCLA. And that really redirected my life and my career, and that's also indirectly, or I guess directly, how I got connected with Exo Leaders through a UCLA Anderson alum who's been part of this initiative as well. My time in LA over the past 23 years now has been really focused on helping to build businesses, helping to build technology businesses, and then eventually what that became is what I call the intersection of technology, health, and wellness, which is something that it's a phrase that I kind of coined as I was working with some businesses in the fitness and nutrition arena, which led me into the wearables space. And then kind of separately, a couple years later, I ended up doing some work in the world of genomics. Mm-hmm. And this is the important time for me to say that I am neither a scientist nor a physician, but I spend a lot of time working with scientists and physicians and kind of helping them communicate with each other, helping to translate between them, and then helping to translate, bringing in investors, attorneys, service providers, other experts to help build businesses. And so, again, I was working in the wearable space, did some work in genomics, and as I started to kind of look at what I was doing, I saw this pattern had emerged where it went from working in the tech world to working in the health tech world. And so I said intersection of technology, health, and wellness. And that's been my path over several years now, really many years, helping to build nonprofit institutions, helping to spin organizations out of hospitals, helping to launch some companies, and most recently, which I know we'll dig into, is running an organization called BioscienceLA.
Exactly, and that ties into my next question. What is BioscienceLA all about?
We are a nonprofit organization, 501c3, a little over 4 years old, and we're sort of a public-private partnership, if you will. We were founded before I came on board, and I'll get to that in a second, but we were founded with some support from the County of Los Angeles, Amgen, which is headquartered here in the LA region and is one of the largest life sciences companies. A couple of hospitals here in Los Angeles, City of Hope, which is a NCI designated cancer hospital, Cedars-Sinai, which is very well known for all sorts of incredible healthcare. Some local philanthropists, Richard Lundquist and Richard Merkin, and then a trade association called Pharma, which is based in Washington, D.C. All those organizations came together a few years ago with the vision to help to essentially connect and strengthen the connections between life sciences, innovations, and innovators in Los Angeles to help grow more businesses here, keep more businesses here, create a bigger economy around life sciences, but also help to create life-saving technologies that emerge from those. This was all happening in 2019. That's where I come into the story. My fun fact, which is very related to healthcare innovation in lots of ways, is that my first day as CEO of BioscienceLA was Monday, March 16th, 2020, which, for those of you listening out there, everyone has their own story of that day, but at least in Los Angeles, that was the day that everything shut down. And, we were basically told to stay at home for a couple of weeks, which ended up lasting a couple of years, I guess. So, crazy time to be coming into an organization that's all about building community and connecting people, because, how do you do that when you can't even get in front of people? The flip side, though, is what an amazing time to come into an organization that's focused on healthcare innovation, because that was that one moment when I think within a few weeks, we had basically everyone in Los Angeles, in California, in the United States, on the planet Earth, who were of a like mind saying, healthcare innovation seems like something that's pretty important. We should figure out how do we innovate to get beyond this COVID pandemic. So it was, in some ways, such perfect timing to be coming into a role that's all about how do we do more to save more lives.
That's a great title for this segment. I started the day everything shut down.
I literally, I don't think I introduce myself without telling that story. I have PowerPoint slides where I have a big, calendar on there, and I circle it because it's one of those moments in time where, we all remember where we were when the world shut down. And for me, it was not just remembering where I was, but remembering that I was, starting something new.
David, you mentioned in your piece in XO Leaders that you're not exactly who you set out to be.
Yeah, I'll say in some ways I'm not who I set out to be. In other ways, I'm exactly who I set out to be. I was too young, immature, and maybe not experienced enough to realize it. So in my piece in XO Leaders, I went to Stanford undergrad, and I was kind of immersed in the tech world there. When I went to school, it was coming out of the heyday of the personal computer revolution. Within a few years, after I graduated, we were going into the internet revolution, the .com era. And so, at various times, I thought I was going to be a tech entrepreneur. And then I got involved in telecom when I was an executive recruiter, and so had this vision of being a telecom venture capitalist. And it was a lot of things about. I wanted to build businesses, yes, and and I think I also looked at this from a standpoint. I want to build businesses and make a lot of money, right? You look at people like a Steve Jobs or a Bill Gates or things like that, and how do I be like them? And so that was kind of the mindset that I went into business school with, and then coming out of business school, as I'm working with businesses and getting involved in this intersection of technology, health, and wellness, what I started to realize was what I really liked was helping other people be successful, helping them build their businesses, helping them grow their businesses, helping them launch, helping them connect. I have a real passion for connecting people and being this advisor that's building something it's bigger than me as a person. It's bigger than any organization I've been part of. It's really building community, building ecosystems, helping to support the growth of lots of big things. And so, again, I feel like in some ways, that's really what I always wanted to be doing. I wanted to build stuff. I think it's really, how I look at kind of where do I count as success? What do I count as being fulfilled? And it's much more about how I'm helping others, how I'm connecting others, sort of call it the multiplier effect. And so that's probably the key thing I didn't realize when I was a 20-something, is this idea of the multiplier effect and how I can really be part of so many people's lives because we're working with them in many different ways.
Wow. A lot of people that I know, they know that we work with leaders, and they ask me, are these leaders destined? Are they just lucky? Do they work differently than what we should do? Was it luck? Were you destined, David, to do what you do?
Yeah, it's a great question, and I think it's like a lot of these, it's a little bit of both. And so just this idea that I love being in front of people. I love kind of helping to guide people. And so, back to the question, I think that there's a little bit of you make your own destiny, and you find these things that make you comfortable over time. And so as you build your destiny, then what gets layered on top of that is an element of luck or chance, because ultimately I sort of look at what I'm doing today. I feel like I can look back 5 years and say, here's what I was doing 5 years ago that led me to what I'm doing today. And then I could say, 5 years ago, I could look back 10 years ago, and here's what I was doing that led to that. And so there's definitely a way to look backwards and say, here's this, not always, it's definitely not a straight line, because I think there's no straight lines in life. There's lots of, curves and ups and downs, but I can look back and say, it makes sense based on what I was doing at every step of the way that I'm here now. At the same time, I could also look at this and say, had I done one thing slightly differently, I would be doing something completely different, and I'd probably still be equally fulfilled. It would look really different.
What called you to life science?
So, and that is such a, I get that question a lot, because, our organization is here to grow life sciences. And so, first of all, people, typically they hear life sciences and they're thinking biotech, they're thinking biology, biotech, and that's absolutely a piece of it. But to me, it's really anything that brings together innovation, technology, and healthcare. So that could be biotech and biopharma. It can be med tech, medical devices. It can be digital health. Here in Los Angeles, even, we have a lot of businesses and a lot of interest around, I'll call it the consumer side of health and wellness. So this is not necessarily things that, it's not necessarily an FDA, classified product. It's, not being sold through an enterprise. It's not being prescribed by a doctor, but it's what we use to help make ourselves healthier. There's a company called Headspace here in Los Angeles that is, meditation app. A lot of people have probably used it. I use that as an example a lot, because that was a company that was founded in London and was growing in London. And at some point, the founders took a step back and they said, if we want to make this business really be what we know it can be, we've got to get into the US. We have to move to the US. And, they could have gone to Boston or New York, because that's, relatively close to London. They could have gone to the Bay Area, because, they're an app, and, every app seems to be in the Bay Area. But they said, we want to be in Los Angeles because we think that's the future of healthcare. That's the place where healthcare innovation is happening. And so, they moved to Los Angeles, to Santa Monica, and they love being here. And so that whole diversity of biotech, medtech, digital health, consumer health and wellness is really what life sciences is about broadly. But then, drilling down a little bit, what it is for me, and, and why I'm doing it is, again, I'm not a scientist, I'm not a physician, but I look at the impact that life sciences, that healthcare innovation can have. And it's sort of a humbling experience, because on the one hand, you can look at developing a life-saving technology, and, sort of look at COVID vaccine, look at penicillin, look at the artificial heart, things like that, where these are technologies that can impact millions and billions of people over time, which is incredible. And, it's this impact on the planet, impact on humanity. But what's also very cool about it is that as fancy as our technology gets, as big as these innovations are, to some extent, healthcare is still very much a one-to-one kind of transaction, right? So, ultimately, for that innovation to save a life or extend a life, it's delivered by a single physician, a single caregiver of some kind, to a single patient, just over and over. And so you can look at this idea of healthcare innovation, extending lives, saving lives, improving the quality of life, and it's both very big. Billions of people on the planet can be benefited. At the same time, it's one at a time, and that to me is just it's both exhilarating but humbling, because it really is kind of connecting people and helping one person help another person, and just repeating that process over and over.
There, you mentioned that LA is becoming a center for life science. Why do you think that is? They could have gone anywhere else. They could have gone to New York or somewhere in Europe, maybe, or
right. Right.
Why
Yeah,
LA?
no, and it's, absolutely. And you think about, life sciences, healthcare, health tech, there's the typical places people talk about, which are the Bay Area, San Diego, Boston. So first of all, California has two of these places that people tend to talk about. Los Angeles has always had an innovation mindset. There's been healthcare innovations here, from the paramedic model to our synthetic insulin, technologies like that. The internet was basically invented in Los Angeles. The electric guitar was invented in Los Angeles. Like, we make cool stuff happen, but that tends to get overshadowed by Hollywood. And people think about Los Angeles, they think about Hollywood. We have this tradition of healthcare innovation, life sciences innovation, but what we haven't had enough of here is a way to connect it and sort of, make it be focused to grow here in a way that other people will take notice. And so that's part of what's happening. And part of that is just, by the way, that's not just happening here. It is happening in New York. Having just gotten back from the Netherlands, there's a tremendous amount of national support for healthcare innovation in Netherlands, UK likewise. And so I think that's cool, because while my job is all about how do we grow stuff in Los Angeles, the way we actually grow stuff in Los Angeles is by connecting it to the rest of the country, the rest of the world, because healthcare is not a zero-sum game. And if we're developing something in Los Angeles that saves lives, I really hope that those lives that we end up saving are in New York, in the Netherlands, in Africa, in Asia, because ultimately, these technologies deserve to be everywhere. But, back to LA, I think that we do have this creative mindset. We have this very diverse mindset and diverse population here. So if you look at LA, there are, more languages spoken here, more cultures, more foods, more microclimates, more of everything than almost any place in the US or the world. And that diversity, I think, really supports innovation around healthcare, because what we're thankfully learning more and responding to more is that diversity really drives innovation. And that applies in any industry, whether it's automotive or creative or consumer packaged goods. If you have a diverse workforce, diverse team, they're going to be developing amazing innovations. I think that's even more important in healthcare, where when you think about a healthcare technology, it really needs to be designed for an increasingly diverse population, more so than a car or toothpaste or something like that. And so I look at like Los Angeles, where we can have this incredibly diverse group of researchers who are helping develop technologies that are being commercialized in a company with a diverse workforce. We're reaching out to a diverse group of patients for clinical trials to develop products that will be delivered by an increasingly diverse physician base or provider base to an increasingly diverse population. And there's a kind of an adage that I use a lot, that the Los Angeles of today is the United States of 20 or 25 years from now. And so the way we innovate here in Los Angeles, what's happening here in LA is what's going to be happening in the rest of the US in another generation. And so I can't think of a better place to be building healthcare innovation than here.
David, I know you're a person that tries to make a difference, an impact every day. What have you done most recently?
Wow. Yeah. Having just gotten back from these international travels, going into a few weeks of conferences, there's so many opportunities, so many examples. But one in particular, there's an entrepreneur that I've been advising for many years, and he's working on a digital health product that's focused on substance use disorders, a company called Pink Cloud. And I have such a passion for what he's doing, because it's a perfect example of helping one person at a time to overcome substance use disorders, and you do that over and over, we're impacting the population. And so we speak, we speak, whether it's in person on a call or over text, almost every day. And this week we've been helping to create some new ideas for him about new events where he can get this product in front of other people, and it's having a real impact, and it will have a real impact. And then on the flip side of that, having just gotten back from these travels and these conferences, I was at this part of this international delegation in the Netherlands. There were we had, I think, 18 countries were represented there from around the world, and I was talking to a healthcare leader from Africa, and we were talking about what I'm doing in LA, what he's doing in Africa, and he said, I would love to find some ways to have a better impact on our population, a better understanding of our population. What could we do around genomics that could make a difference? And he had looked at my LinkedIn and knew that I had some background in genomics, and I said, we have this incredible university in Los Angeles, Charles Drew University, which is basically an HBCU, historically Black college, university focused on healthcare. They're doing some amazing work on genomics in general, but with an orientation toward the populations that that they serve. We need to bring these groups together to work on something, because I think there could be a huge impact. And so, we have not made an impact there yet, but I look at that opportunity and say, this is something where when we follow up, we're going to be able to make an impact, and that impact will, touch on, huge parts of the population eventually.
David, you have an incredible network. You're very, very well connected. Why is that important to you, and what does that mean for what you do?
Yeah, so I think that, and again, that kind of goes back to almost maybe it's those days as a high school newspaper editor or as an executive recruiter. As I've gone through my life, it really has been about building a network. And a long time ago, I started to realize that I'll never know all the answers. In fact, I can guarantee I know almost none of the answers. And I'm not an expert. I'm not a scientist. I'm not a physician. I'm not an attorney. I'm not a venture capitalist. But I know all of these people, and so and I spent some time as an independent strategy consultant, kind of working on my own, but always working with a group of people that I could pull in. And so I remember being in prospective client meetings, talking to someone about a problem they have, and they would say, here's this thing that we've never seen before. You've probably never seen it before. Can we fix this? And I would look at that and I would say, you know what? We've got the resources to make that happen. Like, we can bring the right people together to figure this out. And did I know who those people were going into that meeting? Absolutely not. Did I know some of them coming out? Yes, but also I knew that I could make 5 phone calls walking out of that meeting, and I would have the right extended team of 5 turns into 25, and so on. So this idea of a network, it's being able to get to that right answer, and it's like way less than 6 degrees of separation. I think that you have the right kind of network, and you feel like the right answer, the right people are probably 2 degrees of separation away. So I think that's really why I lean on that network so much, and why I developed that network. But then in the role that I'm in today, in a sense, it really is all about building a network here in Los Angeles, which is then connecting to networks in New York, in Netherlands, in the United Kingdom, and beyond. And so this idea of the stronger the network you have, the more likely you can take that network and exponentially grow it because of other people's networks. And ultimately, if we're trying to change billions of lives, one patient, one physician at a time, I think ultimately you've got to have that network to be able to develop those innovations, and then get them out there to the right people at the right time.
A lot of the people listening to this interview are probably aspiring leaders or people that want to learn from you. You are a leader, David. What would you recommend?
Yeah. So again, and as someone who maybe didn't even realize he was going to be a leader at one point and didn't know what that meant, I still think about this all the time, because to me it goes back to my days as an executive search consultant. As a consultant, the best leader is someone who is listening to others and is learning from others. And so, the best leader is someone who realizes that they don't have all the answers. The best leader is someone who realizes that the way to lead is to empower their team to lead. And so, to me, leadership is really always coming back to, the leader is one person in an organization, which means that most of the organization is everyone else. And whether they're individual leaders of other kinds or they're individual contributors, it's all about how do you help make those people be most successful, most effective. And I think an organization is it's kind of like that the iceberg visual that people always show, right? Which is like, you look at the iceberg and what do you see above the water? And then the iceberg is actually this massive thing underneath the water. Most of an organization, most of a team is not that leader. It's everyone else. And so keep on finding ways to create opportunities, create connections for those people, keep on asking questions, and always keep listening, because the great thing is everyone is a leader at something. Understand what they're a leader at, and leverage that as much as possible, whether it's guidance for one thing. Even my children, I sort of, I'm constantly learning. My kids are 13 and 9, and I'm always learning from them. And in a sense, they're leaders in their own way, right? And they're leading me in, learning about Minecraft or learning about whatever, learning about, cool new toys or Legos or ideas they have. And so it's, again, learn from everyone, and I think you'll be a better leader, and you'll help to create better leaders down the line.
I loved your piece in Exo Leaders, by the way.
Which way my son does come into play in that, right? Because him getting us to watch Stranger Things, binge watch Stranger Things, during the pandemic, was kind of almost the inspiration that got that whole piece started. So my son's right in there.
Good. Nice that you gave him the credit for it. Why was it important for you to participate?
Yeah, it was when I learned about this, and it almost goes back to what we were just talking about, this idea that am I who am I to be writing a piece about being a leader, and why should someone care? And then as you start to peel back the onion of what do I want to be writing about and what's important, you realize that, again, everyone has a story to tell. And so at least at the very least, I had a chance to tell a story, which is great. And I hope people will find it inspiring. Hope people will find it inspiring in their own lives, but then also hope they'll look at that and say, wow, I've probably got a story I should be telling. And whether it's part of Exo Leaders, whether it's part of their LinkedIn post or a podcast they're doing or a blog or just telling their teams, telling their families. I think the idea is the more we inspire each other by our storytelling, the more we can get them doing the same thing with others.
That ties in great with my last question, David. What would you say to leaders who are considering writing to us and saying, I want to participate?
Yeah, so I think I'll flip this around, because I think it's really easy to look at this and say, that sounds really cool, but where do I find the time to do this, and where do I start? And I think all of those are very valid questions, because it takes a little bit of time to write something like this, but it shouldn't take forever, and it takes effort, but hopefully that's effort that's really can be really rewarding. And so I would basically would love everyone who's hearing this to read the book, be inspired by these stories, listen to more of these podcasts, but then start thinking about, what do you have special? What are the multiple things you have special that you want other people to know? And even if you want one other person to know it and be able to refer back to it, this is an incredible opportunity to be able to tell your story and inspire others while supporting students, supporting the future of America, who will eventually have their own stories they want to put into to books like this. And so it's really a great way to think about whether you consciously want to create a legacy, build a legacy, or you just like the idea of reaching people. It's a tremendous opportunity. And so I hope there's almost no reason why someone would say, I can't do this, I shouldn't do it. Everyone has something to tell about. And so I guess, putting it back on you, we have to think about, how does this go from 100 stories to 1,000 stories to, tens of thousands of stories, because that's what could happen eventually.
That would be great. And like you said, we share information. We share information about how leaders think, what their experiences are, their anecdotes, and the earnings of the book go 100% to scholarships in the U.S.
Which is great, because again, it's creating the next generation of leaders and people who will inspire other leaders. And so the more we do that, it's a perfect example of sort of paying it forward in a very real way.
Well, David, I want to thank you for a fantastic interview. If you like this interview, please hit the like button, subscribe, follow us on the different channels, and hope to see you for the next segment. Thank you very much.
Absolutely. Yeah. Thank you so much, Gustav. Really appreciate it. And looking forward to seeing more of these from others and sharing it with others.